Sexual and reproductive health and rights of young people in Asia and the Pacific. My body is my body. My life is my life. Adolescence is a challenging time for young people as they experience rapid physical and emotional changes as they transition to healthy adulthood. But their sexual and reproductive health and their rights are stigmatized in many countries and cultures where the topic is taboo. Stigma around adolescent sexual and reproductive health must be addressed so that adolescents can get the information and advice they need, access services, and exercise their rights to make important decisions about their futures. Sexual and reproductive health services. Adolescents have one of the highest rates of unmet need for contraceptives. In many countries in Asia and the Pacific, unmarried, sexually active adolescents face stigma and social disapproval, which limits their capacity to make their own decisions and limit access to contraceptive services. Let us listen to Tran's story.
I live in a village near Hoi An in Vietnam. When I was 15, I met a boy at school, Đức. He was very charming and we both liked each other a lot and we started dating. Now this year, we are both 17 and feel ready to take the next step and to sleep together. I knew we had to be careful and protect ourselves. So last month, I visited the health clinic near to my school for advice. It was very awkward. The receptionist asked me out loud while I was there and questioned me if my mother knew about it. In the waiting room, older students from my school were sitting and overheard everything. They made jokes, and one even said that they would tell my parents that their daughter was at the health clinic. I was so embarrassed. I ran out of the clinic, and now I can't face going back. Now I don't know who to ask for advice.
Young people risk unintended pregnancies or sexually transmitted infections unless the stigma around accessing contraceptive services and information are removed. Policies need to remove barriers based on age, parental consent, or marital status of young people. Sexual and reproductive health and digital platforms. Digital platforms can give adolescents private answers to critical questions about sexuality, as Torika, who has a developmental disability, discovered.
Bula, I'm Torika, I'm 14 and I come from Fiji. I enjoy going to school with my friends. I sometimes cannot understand every lesson if the teacher talks too fast or uses words I don't know. My friends are always there to help me. For a few months now, I saw that my body has been changing. It was happening to my friends too. So I knew this happens to all girls. One day at school, I was feeling strange, and when I went to the bathroom, I saw that I was bleeding. I was very scared. Was I very sick? Was I going to die? At home, I went to my room and I didn't ask my parents, in case they were sad. I didn't know who I could ask. I didn't even want to ask my friends. So I used my mom's computer and talked to my friends from the disabled persons group online. They showed me a website that had many good questions and answers about teenage problems. I understood that this bleeding happens to all girls, and the pictures on the website explained that this was normal. The next day at school, I talked to my friends and they also explained that this was happening to them. I could also tell my mother I had my period and she helped explain more. Now I know if I have questions, I know where to find the answers.
Like many other adolescents, Tarika found quality, appropriate advice online. While some digital platforms expose adolescents to misinformation, if used correctly and safely, digital platforms can help adolescents to better understand and address their sexual and reproductive health concerns. Comprehensive sexuality education teaches adolescents to safely navigate through the digital space. Diverse sexual orientation and gender identity and expression. Many people in Asia and the Pacific live in communities where the traditions and norms around sexual orientation and behavior limit access to information and services, especially for young people with diverse sexual orientation and gender identity and expression. Let Aryan from India explain.
I have always known that I was attracted to boys, but at school and at home, I was taught that such same sex relationships are not natural and are wrong. But when I turned 16, I met Pranav and we began a relationship, but we had to keep it a secret from schoolmates and family. Other students and people in our town would not understand. We were frightened about how they would react. There were sex education classes in school, but we only learned about heterosexual love and sexuality in classes focused on contraception. They didn't talk about same-sex couples or protection. We had to find data online or try to ask other gay friends, which is hard to do in our own town and risky. Pranav and I have each other but feel alone and misunderstood by our friends and family. No one talks about being homosexual or being transgender, and keeping our love hidden all the time is upsetting and stressful.
It is important to engage adolescents with diverse sexual orientation and gender identity and expression in policy design, delivery, and evaluation of sexual and reproductive health programs to ensure approaches are responsive, inclusive, and acceptable. Adolescents are not a homogeneous group. Each and every person is different, and so are their needs and aspirations. Without the support they need, adolescents have to navigate the complexities of sex and sexuality alone, harming their ability to make the best life choices. Only the full and meaningful participation of young people in the development, implementation, and evaluation of sexual and reproductive health policies, programs, and services, supported by better data, will address their challenges. And the improved health outcomes for adolescents today and the full realization of their rights will not only improve their lives as adults, but also their families and the whole community. What's more, by making the right choices now, they build a strong foundation for love, health, and for well-being in the future.